Hi, I'm your host, Marsha Florence with Just Ask Podcast Live. Good afternoon, ladies and gentlemen, and welcome to your Thursday special, which is definitely Podcast Live with your host, Marsha Florence. Now, ladies and gentlemen, every other week we try to bring you some resourceful information to help you along your way. So today we have a physician in the house, Dr. Samara Chatman of the Center for Functional Health and Wellness. Good afternoon, Dr. Chatman.
Good afternoon, Marsha. Thanks for having me.
Thank you. Now, Dr. Chapman, you know what? It's always a pleasure to have a physician in the house because people always have questions for doctors. So can you tell us a little bit about yourself and your practice?
Yes, absolutely. I've been in practice in family medicine for almost 30 years. And I've had and still have a long, wonderful family medicine practice. And I've always wanted to be a doctor. So here I am, right? Um, my office is located in Southfield, Michigan. And we have actually been in that location for about 20 years. I'm 21 years now. I mean, we're in a new year. So that is where I've been located. I am in the last 7 years, I have added a wonderful form of medicine called functional medicine. And that is what I wanted to talk to you about today.
Okay, because I noticed even the title says functional medicine. What is functional medicine?
Functional medicine is a way of practicing medicine. We look for the underlying cause of your medical problem. We look for the root cause of what's going on. So it's actually practicing medicine in a way to reduce or minimize as much prescription medicine as possible. And it's also understanding that given the right environment, your body can heal itself in many ways. So with functional medicine, we understand that nutrition many times can be a form of medicine, as well as education is super important so that you understand how to listen to your body and what your body's trying to say to you, and how to pay attention to it and what that may mean. But education is key. And so, in looking at you from a different perspective and helping you to understand um, how your body works and what it's doing and why it's doing what it's doing, it helps you become a better participant in your own healthcare. So, functional medicine is the art of medicine in which we are looking to identify the root cause of your medical problem.
So let me ask you this. So if a person comes to you, they already have a physician, but they
Mhm.
feel like they're over medicated or just too many pills of so many kind. Anything over two bottles of pills to me is too much. Okay, 3, 4, 5. It depends on what it is. So when
Right.
a person comes to you and say, "I need a life change," I mean,
Yeah.
do you guys take in consideration that this person coming from another health routine and say, "Okay, we need to break this
Absolutely.
down." So how is that done? Can you give us a little insight?
Absolutely. And that's usually the case, Marcia. Most of the people that come to me have a bag full of medicine, or they may be on one or two pills, but their doctor wants to increase their medicine and they just don't want to do that. And so they believe and they understand that, there's got to be a better way. And they are absolutely right. So with functional medicine, I'll give you an example. Um, Many of my patients that I see, and I will say, I tell people all the time, keep your regular doctor if you want to. We're all on the same team. We can work together, but my methods will only enhance what's already happening. So for example, I'll see a patient that say they have a lot of stomach problems. I mean, and their stomach is gurgling all the time. They may have a lot of bloating and gas, indigestion. Maybe it's constipation, diarrhea, just, the list is endless. And they'll go see their doctor, especially with heartburn. And usually a prescription medicine is given. There may be, some foods that you're told, just try to stay away from this, that, or the other, but usually a prescription's given. In functional medicine, we want to identify, why are you having this heartburn? What's going on in your stomach, in your intestinal lining that's causing the problem, so that when we address that, the need for the prescription medicine is either eliminated or reduced.
Oh,
So that's a very simple example. Same thing for diabetes. I'll see patients and they'll say, oh my God, my doctor just told me I was pre-diabetic. I don't want to be, to be on medication or insulin, or they're already on insulin and they're doing everything that they say that they can do, that the doctor's telling them to do to lower their sugar, but nothing's working. So
okay.
in functional medicine, we are looking at the underlying cause of those issues and working with you from that perspective. And that's the way it actually should have always been. And that's why I set myself apart. I mean, I set it apart from a traditional medical practice because it is approaching you from a different perspective.
So what are some of the other services that your office provides?
Well, some of the other medical conditions that we look at, I work with a lot of people that have obesity. I work with a lot, or maybe they just want to lose 20 or 30 pounds. Sometimes that's not necessarily obesity, but that you need to lose a couple pounds. I work with all sorts of medical problems, from arthritis, sleep problems, indigestion, constipation, IBS, thyroid conditions, rheumatoid arthritis, autoimmune conditions like lupus and sarcoid, some PMS. I mean, fibromyalgia. Anything that can be done in traditional medicine can be approached from a functional medicine's perspective. But Marcia, it's the way that I go about analyzing you that makes it a little different.
Okay. Well, Dr. Chapman, let me ask you this. So when should a person actually seek out your type of service?
Well, you want to see me when, at any point, if you don't want to be given a prescription for something and you'd like to look at a more natural approach, if you don't want to, if you're already seeing a doctor who's probably doing a great job, because, we really do care about our patients, but you aren't happy with the direction of the approach that is taken, or you don't want to increase your insulin, or you can't lose weight and you can't figure out why you can't lose weight, then it's time to see me. Because the way in which I address you, the way in which I look at what the underlying cause for the problem is, again, that's very different. And I can get into that a little bit as well.
Okay. So a question. Now, with the functional health and wellness format, is it similar, or is it definitely a difference between holistic care and functional family?
Mm-hmm. Yeah, and I tell people all the time, they say, is this integrative medicine? No, I don't consider it that way. Functional medicine is in and of itself. It is looking at the underlying cause of the medical problem. So, and then treating you from a natural perspective, understanding that given the right environment and kind of cleaning your system up,
Mm-hmm.
you can many times take that it will correct itself. So many times what's happening with us are hormonal imbalances. So let me give you an example.
Okay.
When I initially address someone with an issue, they come to me. There's about a 5 or 6 page questionnaire that they must fill out, because I need to understand more about you, what your struggles have been, what your lifestyle is, how this is affecting your daily life, all of that. It's all very important. And then once I sit down with you and go through how you answered those questions and what that actually means, many times I can identify the fact that some of what's going on with you, and most of it is actually stemming from a hormonal imbalance. And when I say hormones, I am not talking about your sex hormones, because everybody thinks, oh, estrogen, testosterone. No, we're not talking about that. I'm talking about some of the other super important hormones that help your body function on a regular basis.
And this can be male and female?
Male and female, absolutely.
When we say hormones, people always like, that's a female thing. So
no.
it could be both. Okay.
So the hormones that I'm referring to are things like cortisol. That's your fight or flight hormone. It's the hormone that it increases when you're under stress. And isn't everyone under a lot of stress right now? Absolutely, people are. but it's thyroid, it's serotonin, so there are so many other types of hormones that are regulating your body. And so yes, for men and women, it doesn't matter what the sex are. I take care of men and women in my practice. So when I evaluate and identify what those hormonal imbalances are, now we need to look at, where did that come from? How did that happen? Do you know most of the time it has to do with your gut health?
Wow.
Our intestinal lining is such an incredibly important function of our overall health. We have left it by the wayside, and for some reason just think it's the tube that we eat and poop through.
Mm-hmm.
And it is not. It has so many other functions. So when your intestinal lining is not healthy, when you perhaps have an imbalance of good and bad bacteria, you may have developed leaky gut. There's so many different, you may have an excess production of acid in your stomach. Maybe you're not completely digesting your food particles. There's
Mm-hmm.
so many different things that are going on that start the cascade that eventually causes a hormonal imbalance.
So,
And when
Dr.
that,
I'm
Mhm.
sorry. How long has functional medicine been in existence?
Oh, it's been around for years. In fact, it's probably the premise of Eastern medicine.
But why
So
is it here and I'm going to say in the United States, pretty much I mean, I'm hearing from you for the first time about it, so I don't know. And then our viewers are getting it as well. So
mhm.
is it not something that all physicians practice or do?
You have to train. I was trained to do this, just like I trained for years for family medicine before I became a family medicine doctor. I've been training since, it's been about 7 years now. And so the training was about a 3 year process, but you're always learning because the research is always, finally catching up, and there's always good information coming out. But it is something that you have to seek out and seek to learn more about. Now, your question essentially is, why aren't other doctors doing this? If this is like, something that needs to be incorporated in all healthcare, right?
Yes.
Well, it's for me, it came about because I recognized that we seem to be writing or encouraged to write prescription medicine all the time for everything,
Everything. Mhm.
for everything. And they have side effects. Now, don't get me wrong, I'm not anti pharmaceutical medicines, right? I'm
Mhm.
not. There are some excellent meds out there that are saving lives, and you sure better take your medicine and follow the direction of your doctor. But there are times when we've over medicated our patients, or we may not realize that we're giving them something, and then a specialist that we're seeing is giving them something over here, and there's not always that clear communication. And so some people have duplicates in their medication and all of that. So it's so important to understand that there are other ways. There's more than one way to, I don't want to say skin a cat because I love animals, but you understand what I'm saying. So yes, it is not traditional medicine. And, I think we can all have a conversation as to probably why.
Right.
It's not because what I use in functional medicine, I look at you from a nutritional standpoint.
Mhm.
I look at you from a hormonal standpoint, educational, detoxing. I mean, there's multiple levels. When I talk about nutrition, it's not just understanding how to pick the colorful fruit and the vegetables and all of that.
Mhm.
We have to understand which are the nutrients you're lacking in your body. For example, I have a lady that I'm dealing with her thyroid problem right now. Well, we have really, I mean, she's like 80% better already just on the natural supplements I'm using. However, it was a process to get her there. And the other thing is that she's lacking iodine. Now, iodine is very important for the thyroid gland to produce that hormone. And so, in replacing that mineral, it's, I mean, come on, that is a big part of her treatment. It's
But
just
Dr. Chapman, a lot of people don't recognize or realize what their ailments are. I mean, people are walking around every day,
Absolutely.
IBS, irritable bowel syndrome,
That's right.
constipation, depression,
That's right.
diabetes.
And they
So when they go
know.
to the doctor, they go to the doctor to say, can you fix this or give me something or what to
Right.
do? How does one know when to ask to see or if their physician is practicing functional medicine?
Well, they'll know. I mean, their doctor will tell them if they have another way. And it again, it takes commitment and training to learn how to do it right.
Mhm.
However, if you are the way to know, I mean, the you have to want to not use traditional medicine in the form of, for example, if you say you are having problems with IBS and you've tried all the prescription medicine, it's not working, it's not helping you. Or maybe you're using it and it helps some, but you're tired, you don't want to go that route anymore. It's time to see me. If you have done everything you can to do exactly what your doctor has told you to do, and you're still having your problems, it is time to see me. If you have done everything you know to do to lose weight, you have counted calories till the cows come home. You've pushed away from carbs. You've done this. You've done that. You've eliminated this. You can't figure out why you can't drop those pounds. Now, anybody can starve themselves to weight loss, right? But you're not going to keep that weight off. You got to do it so that it's effective and it will work for a lasting for you. But when you get frustrated because you don't know what else to do with your weight, it's time to see me, because I'm going to tell you straight off that your problem with weight loss is not because you're not counting enough calories and pushing away. Your problem is a hormonal imbalance. Your problem is probably your gut lining. And until we're able to address you from that perspective first, clean up the gut first. And it's a process for that, because I need to identify what your toxicity levels are. Everyone has a toxic burden in their system. Everyone.
When you
If
say we have a toxic burden, is that something that we
toxic,
are eating or
you're
drinking?
eating it and you can't help it. It's in the air, it's in the water, it's in on the food. For example, the pesticides, the preservatives, the food colors, the dyes, the hair care products, the lotions, the soaps. It's endless.
Okay.
There are pesticides, I mean, there are toxins in everything. Now, they will tell you for sure that there's a certain limit that your body can handle, but guess what? When those toxicities build up in your system, they build up over time. So you may have a toxic buildup for 20, 30 years. And then eventually you can't figure out what's going on with you, because maybe your only symptom is that you're fatigued, you're tired all the time. And when you go to the doctor, he tells you you're not anemic. He tells you that your tests are fine, your thyroid is good. And that's a whole nother conversation with regard to how we've been misdiagnosing thyroid problems. But that you think nobody can put their finger on it. And it may very well be that you have your toxic levels, your toxicities in your body have built up to a point where you need that addressed. And it's not just going and buying a detox on the shelf. God knows, don't do that. It needs to be properly done, and you need to be tested in a certain way to try to identify what's going on there. So when I work,
I'm sorry. What's
sorry.
the youngest age that you've worked with? What's the age?
I can work with children as young as 6 or 7 that are autistic. What I do has also been studied at Johns Hopkins for children with autism. And with the approach that I use, because it is a multi-area approach when I work with you, there's several areas that have to be assessed. These same things were done with children at Johns Hopkins with autism, and within 30 days, they had better eye contact. Now, if you have a child with autism, you understand that's huge, absolutely huge. So there really is no age limit, because I've got, my methods can be used in any age, but the oldest has been in like 86, I think is the oldest patient I've had. I've had patients on dialysis. I've had patients with kidney failure. I've had patients with one kidney. I've had healthy young women that just have PMS issues. I've had women that have people that have lost their hair and can't figure out why they have hair loss. So the list is endless with regard to what I can do, because it's a whole body approach. It's not just, you're not just a disease or a condition anymore. You are a person who I know has some degree of an imbalance somewhere in their system. My job is to identify that and then work with that area to help you get better. And I have an incredible success rate.
That's great. But you know what I was going to say to that, Dr. Chapman, is that with the pandemic right now, people are eating, fast foods, home delivery. I thought more or less that a lot of families will become, well, we might as well cook and eat at home, natural stuff. But people, the rate of the increase
in weight gain,
right, is just blown out of proportion now. And then there's the people who are saying, okay, I got to get this weight off before the summer comes. So with that being said, part of that breakdown, because we're in house and stuck at home at this point, what would you suggest a person should start at so they can at least know if they have to come and see a person like you? Can they do something early on so they can prepare themselves?
You know what? It's difficult to answer that until I know what their issues are. See, the person that needs to see me is anybody. It's the person that is on high blood pressure medicine. It's the person that's on no medicine, but just want to stay healthy and get healthier. Okay. It's the person that maybe they want to strengthen their immune system because they need to have a stronger immune system. If I could just say, when we look, everyone's heard of people with thyroid problems or lupus or rheumatoid arthritis, different conditions like that, right? Those are considered autoimmune conditions. Autoimmune. Right. Autoimmune conditions start at the gut lining. They come from an unhealthy gut lining, and it's been like that for years. And then it surfaced as an autoimmune condition. So when I work with those with people that have any condition or not, I look at you from a whole perspective. I look at that gut lining issue. I look at toxicity, potential toxicity issues. It's just, it's too much to, in a 30-minute segment to kind of, because I could break each segment down and spend an hour on it.
Well, we're going to have to come back, but okay.
Yeah, but I can't say there's like a place to start. The place to start is to see me. It actually is. It's just to come into the office, make an appointment, come on in so that you can, I can actually thoroughly assess you and have a good understanding as to what's going on. I see people with depression, especially right now with all this depression. I see people with depression because of, there's just a lot going on. And I will tell you that a couple of the main hormones that we need to help treat depression, help prevent depression, serotonin, GABA, and then there's dopamine. Those are three. I said three. Those hormones, especially serotonin, comes from your gut. So serotonin is the happy hormone. It's the hormone, and dopamine and GABA. When you exercise, you get that rush, a good feeling and all that, right? In the brain, you feel better. When we give you prescription medicine, it's so that we can increase your serotonin levels in your brain. Well, 80% of that hormone is made in the gut. 80%. And then it either goes to the brain or communicates with that. So you need a healthy gut just to prevent depression. Just to prevent depression or even treat it. And there's been research that proves that. So that's what I'm talking about. When I get at the root cause, we want to try to do as much as we can to identify where your problems, or why is your depression worsening, and anxiety? Why is it worsening? What's happening in the other areas in your body? And so that's basically what functional medicine does. It looks at the overall function and health of your entire body and how those things work together.
I'm sorry, there is a severe increase in anxieties right about now.
Right.
Well, it's on the rise, and part of it is the pandemic. Another part is people's lives. What they're doing,
Right.
how
What
they're
they're
living.
doing, and yeah, things are changing. So and so we're seeing suicides. But
Mhm.
my point is the medication that's used, one of the most common medications that's used for that is to help increase serotonin levels in the brain. Well, why don't we look at naturally increasing serotonin levels in the brain, doing it so that the body can do it? Not
Mhm.
saying you won't need some antidepressant. Maybe you will, but maybe it won't be as much. And that's the key. So it's all about utilizing what the body was made to do. And if we have gotten away from that, we keep putting these band-aids on top of something. They just it's you got indigestion, you have heartburn, here, take this pill. Well, let's look at why you're having that problem. I was talking to a lady, and I take care of people all over the state of Michigan. And I was talking to a lady that she's all the way, I think, in Grand Rapids. And her biggest issue was her stomach. I mean, just doubled over, taking several medications, having excess acid production all the time. And she told her doctor, because I tell people, keep your regular doctor. I'm not trying to take you from your doctor. I'll be your doctor if you want me to, but that's not why I'm here. And so she told her doctor that she was seeing me, and the doctor told her, well, whatever she's doing is not going to work. Within a week, that lady was feeling a whole lot better. I talked to her today. It's been about a month. She rarely has any stomach issues. And I said, did you tell your doctor? She said, I told her. And then her comment was, well, it won't last. Well, yes, it will.
That's
Because
not nice. Okay.
that,
Yeah. Well, that's great. I mean, Dr. Chapman, you gave us a wealth of information today, and I appreciate it because I'm sure our viewers will be trying to chime in and connect with you and get some more information and probably come see you. A lot
yeah,
of us a lot of us today who are listening in are like learning something that they knew very little about, and that's functional health and wellness. And so, you say it's not a new chapter, but it's a new chapter in our lives, and
it
we
is.
have to learn how to embrace it and take it in consideration. Will you come back and join us again?
I would love to. Thank you so, so much. I
Oh,
absolutely love to.
thank you. Like I said, I was impressed with just knowing that we're learning something that a lot of us don't hear about, and we have other options now. We don't just have to go to the doctor and take a pill. We
Right.
actually seek a service like yours, and try to do it more naturally, and
Right.
realize that it's not just something emotional. It's coming from the gut, like you said. It
It
starts
is.
from the gut. Okay,
Yes.
so Dr. Chapman, I appreciate you, and I look forward to having you join us again. Okay.
Thank you. It's been my pleasure. Thanks for having me.
Thank you. Now, ladies and gentlemen, you know who I am. I'm your host, Marsha Florence with Just As. And what do I always say? Always you can tune in and catch these same shows on PBS Channel 56 on our Wednesday, 5:30 a.m. or our Fridays at 2:30 p.m. If you should miss this segment, you will see Dr. Chapman's segment later on in the day and throughout the month. So you can always click on to the Facebook page and go back and watch the segment, and do try to contact us 1-800-323-5336, 1-800-323-5336, or email me, Marcia at Just As Talk Show. I'm your host, Marsha Florence with Just As, and what do I always say? If you have a question for a person with a disability or just a general question, don't be afraid to ask. Just ask. I'm your host. See you next time.